Joining us now is the president's chief medical advisor and director of the National Institute of Allergy and Infectious Disease, Dr. Anthony Fauci. Always good to have you. We appreciate your time and insight, doctor. Lots of ground to cover here. Of course, as you know, we were at 3% Omicron just last week. We're now at least 73%. Have we ever seen a virus spread this quickly?
No, quite frankly, we have not. This is really unprecedented in the speed with which this has spread. It has a doubling time of about 2 days, which truly is unprecedented. And that's the reason why we went from such a small percentage right up to 73%. And in the next week or two, you know it's going to be like 90+% for sure.
And the administration announced plans for 500 million free rapid at-home tests to be distributed in January. Is that at all too late? After all, millions are set to gather this week. And is it, I guess it's probably both a matter of being hard to find them and the tests are considered too expensive?
Well, certainly we need to do more. And that's exactly what the president was speaking about. We do have, about 20,000 testing centers that are already up. What the president was talking about was enhancing that even more, not only making 500 million tests available relatively soon, but also setting up systems like having a website that you can actually order tests to be sent to you free, in addition to the fact that we have the capability to be building up to making between 200 million and 500 million tests per month. So it isn't exactly where we want it at this moment, but it is going to rapidly get up to scale so that virtually anybody who wants the test can get it as quickly as possible. It's true we're not there yet, but we're going to get there very rapidly.
But being that we are right here on the holidays time, to go a little bit further on this, the going rate right now for the BinaxNOW rapid test is roughly $24 for two. Do you think that you can reasonably expect families to pay upwards of $150 just to test themselves for the holidays?
No, absolutely, Lindsay, not so at all. And that's the reason why the big push will be to free testing, both reimbursable, which is fine, but actually free, completely free, where you can just get it from being sent to you through a website, as well as picking it up in areas, in places where there will be tests that will be available to take home and do yourself for free.
Of course, we're always balancing the risk, the reward. Are you concerned that there is potentially a greater risk to advising Americans to going ahead and proceeding with their family gatherings with the variant spreading so quickly?
Well, it depends on what you mean by a gathering, Lindsay. It's very important. If you are vaccinated and your family's vaccinated and boosted, and you're going to have a dinner and just a gathering together with grandma, grandpa, kids, all vaccinated and boosted, even though the risk is not zero, the risk is very low. And you could anticipate enjoying a nice holiday meal and get together. If you're talking about going to a big reception, a party of some sort, where there are 30, 40 people, many of whom you do not know the status of their vaccine, that is something that's very risky. And we clearly recommend you do not do that.
And switching gears here now, the NFL, of course, made changes to allow asymptomatic players to return to the field faster. Are health officials, namely the CDC, thinking at all about changing how long COVID-positive vaccinated Americans need to isolate?
Well, there's one area where they are thinking about it very seriously, and that has to do with healthcare providers who become infected, who are without symptoms. Because if, in fact, we get the wave that we're seeing right now, and we are getting vaccinated and even boosted people who are actually getting breakthrough infections, most of the time, they are asymptomatic or minimally symptomatic. So what the CDC is considering, they haven't made a decision yet, is that when you're dealing with the potential shortage of healthcare providers, that you don't immobilize them for 10 days if they're infected and without symptoms. You get them back to work pretty quickly with something like an N95 mask and extra special care in mask wearing. That's what it is on the table now for discussion.
And data, of course, still coming in, but it certainly appears that having a booster is the best way to protect yourself from Omicron. Is the government thinking at all about changing the definition of what it means to be fully vaccinated to now include having that third shot instead of just two?
You know, Lindsay, what it is really almost semantics. It's been that for the discussion of what is going to be requirements. You know, there's this court cases that go on with regard to OSHA and whether or not you can actually be able to require it for a certain amount. As far as I'm concerned, and my colleagues as public health people and physicians and scientists, optimally, it's a boost, no doubt. If it's an mRNA 2-dose, a boost is optimal protection. So the semantics of what's required and what's not required, I think we should put that aside and let people know that if you want to be optimally protected, go get a booster for sure.
Fair enough, but I do want to ask, though, with regard to the worldwide equity concerns that come with the idea of being fully vaccinated, that you may need those 3 shots. So many countries are now just starting to get access to the vaccine. So how do you juggle between Americans getting the 3, where some countries are still trying to get there first?
You can do both. You absolutely can do both. And the United States is actually leading in getting doses to the low and middle income countries. And hopefully the rest of the world, that's the rich, developed world, will do the same. The United States is doing more than all other countries combined, and that's just a fact. We've already given about 300 million doses. We have a moral responsibility to be able to get doses into the arms of people in low and middle income countries at the same time as we boost and optimally protect our own people here in the United States.
Of course, early indications out of South Africa suggest that Omicron may be more mild. Taking a glass half full kind of perspective, is it possible that if Omicron makes up the majority of the cases here, this could actually be a good thing?
Well, certainly, if that is the case, that could be a positive thing. We know now from very close collaborations and very generous sharing of information on the part of our South African colleagues that when you look at the data, that's becoming pretty convincing that the rate and the ratio of hospitalizations to cases indicate that it is a less severe disease when it comes to Omicron. And that has to do with hospital days as well as the requirement for oxygen. If that holds true in the United States, then that would obviously be a positive thing. However, we better be careful because when you quantitatively have a lot more cases, even if you have less of a severity, that could obviate and overcome the positive advantage of a less severe.
All right, quick rapid fire for you for a second, Dr. Fauci, with regard to holiday travel questions. If you could just answer yes or no here. Would you get on an airplane right now?
If I had to get, I mean, I can't say yes or no. It depends on what the circumstance is. I'm sorry, Lindsay. It really depends. I mean, as far as I'm concerned, whenever you travel, there is a risk, not necessarily on the airplane, but on the process of traveling in an airport in a congregate setting where some people might not be having masks. If I needed to see my family and I was vaccinated and boosted and the people that I were going to were vaccinated and boosted, I would not hesitate to go visit them. But I would not do it for something frivolous like going to a big party with 50 people somewhere, many of whom I don't know what the status of their vaccination is. So it really depends on the circumstances. Sorry for the long answer.
No problem. We'll try yes or no for this. Dine inside.
Excuse me?
Would you dine inside?
Myself personally right now, unless I absolutely knew the vaccination status of the people, I would not.
Would you gather with at-risk loved ones?
Well, when you say at risk, if my at-risk loved ones are vaccinated and boosted and I'm vaccinated and boosted, I would dine with them.
New Orleans said today they are going to go forward with Mardi Gras. I can assume no is your answer for that. You would not go to Mardi Gras?
No, that's a big no for me, Lindsay, big no.
And lastly, and thank you for playing along with that, I've asked you this question before, but more so than ever, there seems to be this kind of inevitability to all of the COVID at this point, all the spread that we're seeing. Should we all just be prepared at this point that we're likely going to get Omicron? And with that belief that if we're vaccinated and boosted, that it'll likely be mild?
Well, it is certainly conceivable that if you are vaccinated and boosted, that there will be breakthrough infections. This is an extraordinary virus. We've never seen anything of the capability of this to be transmitted. Vaccines work when they protect you from getting sick. And that's what vaccine and boosters do for the most part, even when people get infected as a breakthrough infection.
Dr. Anthony Fauci, we thank you so much for your time and happy holidays to you.
You too. Thank you very much for having me, Lindsay.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.